Hey there, and welcome to this explainer. So think about this for a second. We take roughly 20,000 breaths a day, and most of us do it without giving it a second thought. It just happens, right? Well, today we're actually going to look under the hood of our respiratory system. We are going to build a completely actionable toolkit to help you maximize your lung capacity, stretch out those respiratory muscles, and keep your lungs incredibly healthy for years to come. Let's get into it. Let's kick things off with a pretty mind-blowing fact from the experts over at Rush University Medical Center. 50%, yeah, you heard that right. At rest and during most of our normal day-to-day activities, our lungs are literally only working at 50% of their actual capacity. Because our regular daily routine doesn't force us to use our lungs to their absolute fullest, this stale air can just sit there and build up over time. And just like the rest of your body, your lungs thrive on movement. They crave activity. Without that challenge, you are leaving a massive amount of respiratory potential completely on the table. All right, so here's our roadmap for today. We're going to cover 1, the aging lung, 2, measuring lung capacity, 3, daily lung health habits, 4, targeted breathing exercises, and 5, a really fascinating look at musical respiratory therapy. Starting right off with section 1, the aging lung and exactly how time impacts your breathing. Okay, so what's really fascinating and maybe a little surprising is that lung function actually begins to gradually decline way earlier than most people realize. We're talking between the ages of 30 and 35. And it's not just one single thing, it's a whole system-wide change. Your lung tissues naturally start losing their elasticity. Deep down inside the lungs, those millions of tiny air sacs, the alveoli, begin to enlarge. This actually shrinks their surface area, which kind of messes with their ability to transfer oxygen right into your bloodstream. And get this, even your structural framework changes. Your diaphragm and your breathing muscles lose strength, and your rib bones can actually thin out and change shape. That literally restricts your rib cage from fully expanding. Plus, on top of all that, your airway walls can get thicker and narrower. But hey, don't let those biological changes get you down. There's a great quote here from Dr. Francesca Polverino at the Baylor College of Medicine that hits the nail on the head. She points out that while this decline totally happens, it is absolutely not an inevitable defeat. By doing things like quitting smoking, improving your indoor air quality, and just staying physically active, you can actually stabilize your lung function. You can actively protect that high functional reserve your lungs have, ensuring that aging doesn't just automatically equal breathlessness. Moving right along to section 2, measuring lung capacity. Let's break down the metrics. Before we start actively trying to improve our lungs, we kind of need to know what we're measuring, right? So the big takeaway here is your vital capacity. This is basically the grand total of air you can consciously move in and out. It combines your normal resting breath, what's called your tidal volume, with your reserve volumes. In a typical healthy adult, we're talking about a total of 3 to 5 liters of air. Picture 3 large soda bottles just sitting on a table. That is the sheer volume of air we're dealing with. Now keep in mind, this metric is super individualized. It's heavily impacted by things like your age, your biological sex, your height, and your body mass index. Now, when you go to a clinic and they have you blow as hard as you can into that little tube, a spirometer, doctors are checking your forced vital capacity for 2 very specific things. They want to see if your airflow is obstructive or restrictive. If your airflow is blocked, meaning it takes you a really long time to push the air out, but your overall volume is mostly fine, that usually points to an obstructive issue, like asthma or COPD. But if your lungs are literally physically restricted from expanding to hold that air in the very first place, causing a distinctly lower vital capacity, well, that points to a restrictive disease like pulmonary fibrosis. Knowing the difference here is completely crucial for figuring out how to maintain your health. All right, on to section 3, daily lung health habits. Time to build our everyday toolkit. Since your lungs are basically these soft, spongy structures, they literally only take up the room that you give them inside your chest. If you're slouched over a keyboard all day long, you are physically crushing your vital capacity. It's true. So simply sitting up tall, leaning back in a good chair, and just reaching your arms overhead every once in a while physically opens up the front of your body. And look at these other foundational habits. Staying hydrated is surprisingly huge because it thins out the mucosal linings in your lungs, letting them function so much more smoothly. And of course, squeezing in 20 minutes of moderate aerobic exercise, even just a brisk walk, forces those lungs to clear out all the environmental junk we breathe in. I absolutely love this next tip from Dr. Sujay Bengrulingam at Rush University. You know what's a great workout for your respiratory system? A really good, deep belly laugh. Seriously, when you laugh hard, you're heavily engaging those abdominal muscles and forcefully pushing out all that trapped, stale air resting at the bottom of your lungs. This creates a sort of vacuum effect that literally pulls fresh, oxygen-rich air deep into parts of your lungs that might normally just sit completely dormant. How cool is that? Now, if getting out for physical activity is tough for you right now because of existing lung problems, don't worry. Pulmonary therapists actually highly recommend joining a support group. For instance, the American Lung Association has these awesome Better Breathers clubs. You get to practice targeted breathing techniques in a really supportive social setting. It's just a fantastic way to stay accountable, learn from others, and genuinely improve your everyday quality of life. Which brings us nicely to Section 4, targeted breathing exercises, and how we can actually retrain your diaphragm. Okay, let's actually try this first exercise directly from the American Lung Association. It's called pursed lip breathing. We're going to do this together right now. Go ahead and drop those shoulders, relax your neck. Now breathe in nice and slow through your nose for a count of 2. 1, 2. Now pucker your lips together, kind of like you're about to blow out a birthday candle, and breathe out slowly for a count of 4. 1, 2, 3, 4. By breathing out for twice as long as you inhale, you're creating this amazing back pressure that keeps your airways open longer. It's the perfect way to ditch that stale air and naturally calm your breathing rate down. Here's another wildly powerful technique. This one is heavily utilized by Memorial Sloan Kettering Cancer Center, specifically for patients recovering from severe respiratory infections like pneumonia or COVID-19. It's the 4-8-8 method. You breathe in for 4 seconds, you hold it for 8 seconds, and then you exhale through those pursed lips for 8 seconds. That 8-second hold, that's the secret sauce right there. It gives those tiny little air sacs maximum time to pull oxygen into your blood and yank the carbon dioxide out before you push the waste gas away. Doing this just 3 times a day can dramatically boost the oxygen levels throughout your entire body. And finally, Section 5, musical respiratory therapy. This is a totally unexpected but brilliant solution. So, beyond the standard clinical exercises, medical research has confirmed something genuinely beautiful. Making music is profound respiratory therapy. Whether you're playing a wind instrument or singing in a choir, you are using the exact same optimized, deep diaphragmatic breathing that medical professionals teach for lung rehab. Both of these activities rely on a valve, like your vocal cords or the reed of an instrument, and they demand that you take these massive, deep inhales that expand your belly, followed by super slow, highly controlled exhales. And the data backing this up is just fantastic. Engaging in musical therapies doesn't just make you feel good emotionally. Studies show it significantly improves your actual physical airflow metrics, like your forced vital capacity. There are programs out there called Singing for Lung Health that have proven patients with COPD, asthma, and even long COVID who sing regularly experience less breathlessness, stronger respiratory muscles, and way fewer depressive symptoms. It's an incredibly effective, low-cost therapy that literally brings joy back into the healing process. So as we wrap up this explainer, I want to leave you with a question. What are you going to do today to give your lungs more room? Seriously, will you sit up a little straighter at your desk, maybe try that 4-8-8 breathing trick, or just allow yourself a massive room-shaking belly laugh? Remember, your lung capacity is totally a use-it-or-lose-it system, and if a simple shift in how you breathe can literally alter your cellular oxygen levels, well, it kind of makes you wonder, what other automatic functions of our bodies are just waiting for us to take control and unlock their hidden potential? So take a deep breath in, expand that chest, and start reclaiming your respiratory power today.